Welcome to the Medical Staff Quality Provider Orientation. In medical staff quality, our goal is to help improve the care to our patients by partnering with providers to help identify system issues, as well as opportunities for improvement. In this module, you will learn about the peer review process, ongoing and focused professional practice evaluation process, also known as OPI and FOPI, and also learn about the FOPI for cause and clinical care audits. The Quality Assessment and Improvement Committee, also known as the QAIC for short, is Atrium Health's physician peer review process. Peer review is part of the ongoing professional practice evaluation process. Multidisciplinary teams discuss cases that come before the committee to identify any opportunities for improvement. A large focus is to identify system issues that can help prevent patient harm. At Atrium Health, we have several levels of peer review. At the clinics, ambulatory care has its own QAIC to evaluate events that occur outside of the acute care setting. All acute care cases are finalized at the facility level, but we do have the opportunity to utilize our metro level specialty QAIC for those cases that are highly specialized and would benefit from a review of a team of same specialty providers. Each metro QAIC has providers from every facility that has the specialty. Events are identified in many different ways. In patient detail reports, every patient discharge and mortality receives a high-level review, looking at not present on admission diagnosis codes as well as procedures during the visit. Referrals are received from multiple sources such as risk management, nursing, committees, peer, and self-referrals. Peer review focuses on the quality of patient care. This includes the process of care, communication, and resource utilization. A main goal of the process is to try and identify system issues that can be identified and addressed to help keep providers from experiencing recurring errors. When a case is reviewed at committee, there is a vote for the attestation of care. Each provider will receive a results letter that will highlight any system issues identified during the review as well as any action plans. Over time, if there are multiple cases for a provider, a trend analysis will occur to identify if there's a need for further review. We encourage our providers to be a part of the peer review process. When a case comes to peer review, the physician reviewer is encouraged to reach out to the provider involved to get their input. Input can be requested by a letter as well. This list shows our current active Metro Specialty Committees. This list is subject to change as new committees are added. New committees are approved through a process including Atrium's System Medical Executive Committee and the facility-specific Medical Executive Committees. Once approved, information goes out to all the QAIC teams about the new Metro Committee. This slide depicts the flow of information for cases. Our system also has a separate external peer review committee, which was created to fill a need with our regional facilities, but is now also being utilized by facilities outside of Atrium as well as some of our metro facilities. The ongoing and focused professional practice evaluations are two of the main processes that medical staff quality facilitates. These processes are required by the Joint Commission, but engaging in ongoing quality evaluations of the quality of care provided to our patients is the right thing to do. Prior to this process, quality review was only completed at the time of reappointment, which was every 2 years. All credentialed providers go through this process and the documents flow up to the Medical Executive Committee at each facility. A FOPI for cause is in the simplest terms a standard process for performance improvement. When a provider first joins Atrium Health or is requesting additional privileges, they must undergo the Focused Professional Practice Evaluation. Data is pulled 3 months post-board approval and usually pulled for a 6-month range to cover any time spent practicing under temporary privileges prior to board approval. Every provider has the ability to log in and see their data. Please reach out to one of us if you would like to know how. Our contact information is at the end of this slide deck. The ongoing professional practice evaluations are conducted every 8 months. Analysts run the physician focus profiles out of Premier and review every provider's data. They will then conduct a drill down into any data that appears to be out of range to identify trends and true opportunities. Once completed, providers who have had at least 12 encounters will receive a letter letting them know that the OP period has completed. Providers who do not meet the threshold of 12 encounters will roll over to the next OP period. Our allied health professionals have a different process for FOPI and OP. Allied health professionals do not have consistent data in our Premier system. Therefore, we send out evaluations to be completed by a sponsoring physician, a peer, and a nurse manager. For some specialties, we do not have access to data. In those instances, such as anesthesia and radiology, no evaluations are sent. Allied health professionals go through the OP cycle with their specialty every 8 months. For those specialties that do not have data, there will be evaluations sent out to be completed by a peer and a sponsoring provider. These evaluations are sent out 2 months prior to the OP month with a deadline stated as to when the evaluations need to be returned. After the deadline, the allied health professional will be considered delinquent for the OP and rolled into the next OP period. A delinquency list is sent up through the reappointment process. There is another type of FOPI utilized at Atrium Health, and that is called the FOPI for cause. In the simplest terms, the FOPI for cause is the standardized format for documenting and communicating a process improvement project. Listed are several examples of FOPI for cause triggers. The 2 most common, however, are when an OP opportunity has been identified or from a peer review case. A FOPI for cause is initiated when a trend or opportunity for improvement is identified through peer review or the OP process. There is a process that will define the steps that may include education, followed by chart review, proctoring, or other methods of evaluation. This will be presented to the provider in the form of an initiation letter. The review and education will be assigned to a provider in the same of comparable specialty. Once the time period and number of reviewed cases and/or charts indicated in the FOPI for cause are met and reviewed, the FOPI for cause will be presented at the QAIC committee and, if approved, closed. If a FOPI is extended, another letter will be sent to the provider. This slide shows some of the different actions that can be requested in a FOPI for cause. The aim of a FOPI for cause is always to educate and assist a provider in improving care and providing the resources and support that they need. If a FOPI for cause is assigned, there is a strict standardization process that you can expect. The initiation letter will detail exactly what is expected of the provider and what audits will be completed. There are 3 clinical care audits performed by the MSQ team that are related to providers. They include reviews of patient safety indicators, review of blood utilization, and surgical indicators. Patient safety indicators are related complications and adverse events. Our role in medical staff quality is twofold. When a PSI is identified, we complete a concurrent review to identify any exclusions or other inquiries into the coding. Our team works with providers, coding, and CDI to ensure that a PSI is accurate. Once a PSI is identified, we also review the case for possible peer review. As per the Joint Commission standards, we review a sample of blood transfusions to identify if they are meeting appropriate indications as set by the Metro Blood and Tissue Committee. Every year, each facility selects procedures to review for appropriate indications for surgery, as well as to review if the pre-op diagnosis and the post-op diagnosis match. This is also a Joint Commission requirement of review. Every facility identifies procedures by low or high volume or high risk.